if you catch COVID-19 and other viruses, it is a much higher risk for myocarditis, heart inflammation, and heart issues.
What are some of the questions that we're hearing about the COVID vaccine? Dr. Tanya, why don't you start us off with that?
Yeah, I've been giving the COVID vaccine to kids age 5 through to 11 in my office, and I feel like almost every parent asks me about myocarditis because it was a very rare side effect seen mainly in older teen boys, 1 in 40,000. So extremely rare. Almost everyone fully recovered within a month. There was no permanent heart damage. And so what I often explain to people is that this was a rare side effect. However, it's more important to know that if you catch COVID-19 and other viruses, it is a much higher risk for myocarditis, heart inflammation, and heart issues.
I would add that I think that dosing is really important information for parents to realize. I have gotten a lot of questions about the 5 to 11 vaccine, and inevitably, people do not know that this is a third of the dose that the 12 plus were getting, and that the data actually from the trial showed minimal side effects after vaccination, like fever, headache, and fatigue, which I think usually is really worrisome for parents, right? And so I thought the data looked incredibly encouraging, and I am so excited personally that my 8-year-old is vaccinated.
The other thing that we don't talk about that much is long COVID, which we do see in kids. What I see in my office is the kids that did get COVID-19, every month they're getting sick, sinus infection after pneumonia, after ear infection, and needing more antibiotics. So there are all these other things that you may not realize that can be so serious, and the reason why we really don't want kids to get COVID-19.